Hello, I'm Sam Rajaratnam, consultant orthopaedic surgeon. I'm a knee specialist and I treat a number of acute and chronic knee injuries throughout various hospitals in southern England. The anterior cruciate ligament, or the ACL, is a very important ligament inside the knee that gives it rotational stability when a patient is changing direction whilst running. It is very commonly injured in footballing or skiing type injuries where the patient feels the knee giving way and a pop within the knee and a swelling that develops pretty quickly over the first 2 to 8 hours. The treatment options vary between conservative treatment and surgical reconstruction, and both should really go hand in hand to give the patient the best function. I treat a number of sporting athletes, varying between the amateur recreational sports person and the professional athlete. The rapid recovery program for ACL reconstruction involves early physiotherapy with appropriate prehab routines where we optimize the patient and get the knee bending and straightening comfortably. It is very important that the acute knee injury is treated quickly by an expert in order to get the knee in peak function, to then reassess and see how much instability exists within the knee. Occasionally, 1 in 10 ACL injuries stabilise enough with physiotherapy and conservative means such that twisting and turning activity is comfortable and the knee does not give way. In this instance, the patient or the athlete can return to their pre-injury level of sport without surgical reconstruction. The patients who require surgical reconstruction following ACL injuries often have giving way of their knee when they twist and turn, or they change direction when they're running. The key thing here is to reconstruct and stabilise the knee before further injury occurs to the cartilages and the surface of the knee. So surgical reconstruction has been developed and has been refined over the last 30 years, and we now are able to reconstruct these as day case procedures. The enhanced recovery program for ACL reconstruction involves appropriate physiotherapy and prehabilitation, that is, the patient knowing what they're meant to be doing during surgery and after surgery, before they come in for surgery. We use the latest techniques of reconstruction, often using the patient's own hamstring graft, but an alternative is the patella bone tendon, or indeed allograft, where you can insert tendon from a tissue bank into the knee to stabilise it. All of these methods will be chosen by your surgeon and customised for you. We then get the patient working hard with our physiotherapist, and often they can be discharged within 6 to 8 hours of surgery very safely and very comfortably. After ACL reconstruction, the graft interdigitates with the bone tunnels, and it gradually strengthens over the first 9 months to a year. Most patients go back to their pre-injury level of sport at about a year post-surgery, but it varies from patient to patient and from how they are progressing with their physiotherapist. But generally, an ACL reconstruction is a very successful procedure which enables patients to return to sport within a year of surgery, but maybe sooner in certain circumstances.